pain control in treating low back, neck pain, upper or lower extremity radiculopathy is always a challenge to the clinician. Many people are on opioids with an epidemic, many of them taking NSAID drugs. Curcumin is an alternative as an anti-inflammatory agent. Let's look at some references. Number one, here's a flyer on a formula called Disc and Joint Pain Relief Complex. I'll give you the contents of this, the ingredients, and what research says about them. First of all, curcumin alleviates lumbar radiculopathy by reducing neuroinflammation, that is, the cytokine inflammation of interleukins, tumor necrosis factor, and other cytokines. It reduces oxidative stress and also reduces nociception type 4 receptor irritation. The two key effects of curcumin, therefore, it is a strong antioxidant and is an anti-inflammatory for inflamed nerve roots. Get this, a paper done in 2016 showed that curcumin shows superior results over anti-inflammatory change. It is better than corticosteroids. So when I see people who are on NSAID drugs and certainly opioids, if we gently put them into curcumin, which does not have those adverse side effects and yet is more effective than steroids, it's very positive treatment. Curcumin has been shown to exhibit anti-tumor activity in a wide spectrum of human cancer, even leukemia. Other things show that curcumin is a natural compound with neuroprotective properties and has been reported to prevent aging and improve memory. Another paper shows that curcumin promotes spinal cord repair, and we see spinal cord nerve root damage in spinal stenosis because it inhibits glial scar formation. What are glial cells? They are the lining cells of the neuron that have to do with nutrition, protection, elimination of waste products from neuron metabolism. It reduces inflammation. Another paper shows that curcumin has a profound anti-inflammatory therapeutic potential in the treatment of spinal cord injury, especially when given soon after the injury. Curcumin is an active ingredient extraction from the turmeric and has been demonstrated to ameliorate dorsal root ganglion neuropathic pain. Why? Neuropathic pain is damage to the neuron. Chemical inflammation, the cytokines, the tumor necrosis factor, when alleviated by curcumin, is what has been demonstrated to ameliorate dorsal root ganglion origin neuropathic pain. Curcumin is capable of promoting peripheral nerve regeneration in normal condition. Curcumin also promotes nerve regeneration and functional recovery after sciatic nerve crush in the diabetic rat model. Other things that we have put in to this disc pain relief formula are certain herbal remedies: devil's claw, white willow bark, turmeric, bromelain, white willow bark, Boswellia serrata, quercetin. These are all additives which have demonstrated anti-inflammatory and analgesic properties in treating nerve irritation. Cochrane data-based system review shows that the use of white willow bark, devil's claw, Boswellia serrata are probably better than placebo for short-term improvements in pain and rescue medications. Another paper shows that the use of cayenne powder produces relief of pain more than a placebo. Evidence for these substances was of moderate quality at best, and so there's still question about just how valuable these formulas are in the relief of pain. I find some people find greater relief than others. But it is said that curcumin may be a valuable and safe alternative to NSAID drugs in patients suffering from degenerative joint disease. Several studies suggest that curcumin may ease the symptoms of osteo and rheumatoid arthritis, like pain and inflammation. Other compounds in turmeric might also be medicinal. Curcumin seems to block the growth of certain kinds of tumors, although not conclusive. It is suggested to help stabilize colorectal cancer, protect against type of skin diseases, Alzheimer's disease, colitis, stomach ulcers, and high cholesterol, help diabetes, HIV, uveitis, and viral infections. There is no standard dosage. It might pose a risk of ulcers in some people who are highly sensitive to bleeding. You should always talk to your doctor before using turmeric products, and especially if you have gallbladder or kidney diseases. They could interact with medicines like aspirin, NSAID painkillers, statins, diabetes drugs, blood pressure medicines, and blood thinners. They can interfere with supplements that decrease clotting, like ginkgo, ginseng, and garlic. Given the lack of evidence on any side effects, they should not be used in pregnant women or those who are breastfeeding. This is the formulation of our disc formula for pain. This contains 800 milligrams of curcumin, 200 milligrams of ginger root extract, 100 milligrams of white willow bark, 100 milligrams of Biloela serrata, 100 milligrams of quercetin, 50 milligrams of devil claw powder, 50 milligrams of valerian root, 50 milligrams of passion flower, and 20 milligrams of black pepper. Why do we add black pepper? Because it is known that black pepper is a key chemical that enhances the bioavailability of curcumin. It aids in the function of curcumin's function as an anti-inflammatory and pain reliever. So this is our formula for instituting to people with pain and inflammation in the acute stage. It does compare very well to the use of NSAIDs. It has been shown to be superior to corticosteroids. You must be cautious in its prescribing. This is what we use for pain. So, thank you.